Dr. Michael Thompson stood in front of Riverside General Hospital, his white coat freshly pressed, a stethoscope hanging neatly around his neck. The sun glinted off the hospital's glass doors as patients, nurses, and doctors moved in and out, each lost in the organized chaos of healthcare. This was the day he had worked for, sacrificed sleep for, and endured years of training to reach. He took a deep breath, letting the reality sink in. He was finally a physician. As he stepped inside, the familiar scent of antiseptic filled his lungs, mingling with the distant hum of beeping monitors and hurried footsteps. The walls were adorned with motivational posters about teamwork and patient care, but Michael knew that real-life hospital work was far from the idealized images they portrayed. "Dr. Thompson?" A woman's voice called out. He turned to see a woman in her mid-40s, her dark hair pulled into a tight bun, a warm smile on her face. "Yes, that's me. Welcome to Riverside," she said, extending a hand. "I'm Dr. Susan Patel, Chief Resident of Internal Medicine. We're thrilled to have you here." Michael shook her hand, appreciating the genuine warmth in her tone. "Thank you, Dr. Patel. I'm honored to be here. Please call me Susan. Let me show you around." As they walked through the busy hallways, Michael took everything in, the constant motion, the quick exchanges between doctors, the quiet determination of nurses. Medicine was as much about adaptability as it was about knowledge, and he was eager to prove himself. "Your first rotation is in internal medicine," Susan explained. "You'll be working with a variety of patients, including some long-term cases. I reviewed your file, top of your class, strong recommendations. You'll do well here." Michael smiled, though he felt a twinge of nervousness. No amount of accolades could prepare him for the unpredictability of real-life medical practice. Susan led him to the staff lounge, where several doctors and residents were gathered. Some glanced at him, offering polite nods, while others continued their conversations. A tall, blond man approached, his smile friendly. "Hey, you must be the new doc. I'm Dr. Eric Carter, third-year resident. Michael Thompson. Nice to meet you. First-day nerves?" Eric asked with a knowing smirk. "A little," Michael admitted. "Don't worry, you'll get used to it. Just remember, trust the nurses, double-check everything, and never let a patient see you panic." Michael chuckled. "Good advice." Susan checked her watch. "All right, Michael, time to meet your first patient. Let's see what you're made of." Michael was assigned to room 307, where a 58-year-old man named John Harris was admitted for chest pain. The chart noted a history of hypertension and smoking, but nothing immediately life-threatening. Taking a deep breath, Michael knocked and stepped inside. Mr. Harris sat upright in bed, his arms crossed, his face set in a deep frown. He had short-cropped gray hair, and his skin was weathered, likely from years of outdoor labor. Beside him sat a woman, presumably his wife, who offered Michael a small, hesitant smile. "Good afternoon, Mr. Harris. I'm Dr. Thompson, and I'll be overseeing your care." Mr. Harris looked up, his expression shifting from neutral to something unreadable. His gaze lingered on Michael for a beat too long. "You're my doctor?" His tone wasn't accusatory, but it wasn't welcoming either. Michael had encountered this reaction before, though it never got easier. "Yes, sir. I'll be working with you to get to the bottom of your chest pain." Mr. Harris exhaled through his nose, but said nothing. Michael continued as if he hadn't noticed the tension. "Can you describe the pain you've been experiencing?" Mr. Harris's answers were clipped, his tone distant. "Pressure. Started 2 days ago. Comes and goes." "Any shortness of breath?" A brief shake of the head. Michael pressed on, performing a physical examination, listening to Mr. Harris's heartbeat, checking his vitals. The clinical part was routine, but the atmosphere in the room was anything but. Mr. Harris's gaze never quite met his, and when Michael reached for his wrist to check his pulse, the man stiffened ever so slightly. Mrs. Harris noticed and quickly interjected, "John, let the doctor do his job." Michael pretended not to notice the discomfort, keeping his voice steady. "I'm going to order some tests to get a clearer picture of what's going on. In the meantime, I'd like you to rest and let me know if the pain worsens." Mr. Harris gave a noncommittal grunt. Michael turned to Mrs. Harris. Do you have any concerns? She glanced at her husband before shaking her head. No, doctor. Thank you. As Michael stepped out of the room, he let out a slow breath. He had dealt with resistant patients before, but this felt different. There was something in Mr. Harris's demeanor that went beyond discomfort. It was something deeper, something uglier. Later that evening, Michael sat in the staff lounge, reviewing patient charts when Susan approached. How'd it go with Mr. Harris? She asked. Michael hesitated. He was distant. Susan sighed. Some patients are like that. But if you're sensing something else, trust your instincts. Michael hesitated before voicing what had been on his mind. I think he might have a problem with me. Susan's expression didn't change. It wouldn't be the first time we've encountered that. Michael exhaled. I don't want to assume anything, but his reaction to me felt different. Susan leaned against the counter, folding her arms. You're not imagining it. We've had cases where patients requested a different doctor for reasons that weren't based on medical concerns. Michael's jaw tightened. What happens in those cases? We have a policy, Susan said. If a patient refuses care based on a doctor's race, we educate them. But if they insist, we reassign the case. Michael absorbed this. I don't want to force myself on a patient who doesn't want my care. But I also don't want to ignore it. Susan nodded. Let's see how things develop. If he formally requests a different doctor, we'll handle it then. Michael appreciated her support, but the knot in his stomach remained. He had worked too hard to let something like this derail him, but the thought of being judged for his skin color rather than his skills was a bitter pill to swallow. As he prepared for the next day, he resolved to stay professional, no matter what. But deep down, he knew this was only the beginning. Dr. Michael Thompson had hoped that with time, John Harris would warm up to him, or at the very least, tolerate his care. But the tension in room 307 only seemed to grow thicker with each visit. Every morning, when Michael entered the room with a polite nod, he was met with silence or the bare minimum of acknowledgement. It wasn't unusual for patients to be irritable. Being in a hospital wasn't exactly pleasant, but something about Harris's demeanor felt different. It wasn't frustration, it was rejection. On the third day of his rounds, Michael entered the room with the usual professionalism, clipboard in hand. Good morning, Mr. Harris. How are you feeling today? Mr. Harris barely looked up from the television mounted on the wall. Same as yesterday. Michael checked the monitor, noting that Harris's vitals were stable. That's a good sign. The test results should be in soon, and we'll have a clearer picture of what's causing your chest pain. No response. Michael pressed forward. Have you experienced any more discomfort? Shortness of breath. Harris sighed audibly, shifting in his bed. I told you. Same as yesterday. Michael nodded, unfazed by the dismissiveness. Understood. Let's check your heart rate and do a quick exam. He reached for Harris's wrist to check his pulse, but the older man recoiled, yanking his arm away. I don't need you touching me, Harris muttered, his tone sharp. A flicker of emotion passed through Michael, but he kept his expression neutral. I understand you may be uncomfortable, but I assure you, this is a necessary part of your care. I said I don't want you touching me, Harris repeated, this time louder. Mrs. Harris, who had been sitting quietly in the corner of the room, cleared her throat. John, stop it. Michael glanced at her, noting the nervous way she clasped her hands together. It was the first time she had openly disagreed with her husband since Michael's arrival. Harris ignored her, instead turning his gaze directly to Michael for the first time. I want a different doctor. There it was. The words Michael had been expecting, but had hoped not to hear. Michael took a slow breath. May I ask why? Harris looked away, jaw tightening. Just want someone else. That's all. Michael held his ground. If there's something about my care that concerns you, I'd like to address it. My priority is your health. Harris let out a humorless chuckle. I'm sure it is. Mrs. Harris placed a hand on her husband's arm. John, please. You're being unfair. Harris pulled away from her. I just don't want him as my doctor. All right? I have the right to request someone else. Michael felt a cold weight settle in his chest. He had faced prejudice before, but experiencing it here, within the walls of a hospital, where he had sworn to treat every patient with the same dedication, felt different. Keeping his voice level, he said, "I'll speak with my supervisor." He turned and walked out of the room, his grip on the clipboard tightening. Michael found Dr. Susan Patel in her office, reviewing case files. She looked up when he knocked, immediately noting the tension in his posture. "What happened?" she asked, setting her pen down. Michael exhaled slowly, choosing his words carefully. "John Harris just requested a different doctor. He wouldn't say why, but I think we both know the reason." Susan's expression darkened. "Damn it." She leaned back in her chair, rubbing her temples. "I was hoping this wouldn't happen, but I can't say I'm surprised." Michael sat down across from her. "I don't want to make assumptions, but he's made it pretty clear he doesn't want me treating him. He won't even let me touch his wrist for a pulse check." Susan sighed. "We have a protocol for this. Officially, we don't reassign doctors based on racial bias. If a patient refuses care for non-medical reasons, we educate them. But if they absolutely refuse treatment, we have to consider patient comfort, even if it's frustratingly unjust." Michael frowned. "So what do we do? Give him what he wants?" Susan shook her head. "Not yet. First, we talk to him directly. If he insists, we'll document it, and the administration will decide how to proceed." "But Michael," she leaned forward, her expression serious, "this is not a reflection of you. It's a reflection of him." Michael nodded, appreciating the sentiment, but it didn't erase the sting. "I know, but it still feels like I lost before I even had a chance." Susan stood. "Let's go talk to him together." Back in room 307, Mr. Harris's expression remained stubbornly closed off as Susan entered alongside Michael. Mrs. Harris looked visibly uncomfortable, her hands folded tightly in her lap. "Mr. Harris," Susan began, her tone firm but calm, "Dr. Thompson has informed me that you've requested a different physician. I'd like to understand your reasons." Harris's mouth twitched. "I just don't think he's a good fit." Susan arched an eyebrow. "Dr. Thompson is an excellent physician. His training and qualifications are on par with anyone else in this hospital. So, I'll ask again, why do you want a different doctor?" Harris's fingers drummed against the blanket, his eyes darting to his wife, then back to Susan. "I don't need to explain myself." Susan's expression remained unreadable. "Actually, you do. Because at this hospital, we don't make care decisions based on personal biases." Harris's face reddened. "Now hold on. I understand patient comfort is important," Susan continued, not letting him interrupt. "But refusing care without a valid medical reason disrupts treatment. So I need you to be honest. Do you want a different doctor because of Dr. Thompson's race?" The room fell into heavy silence. Mrs. Harris shifted uncomfortably. "John." Harris's jaw clenched. "I don't have to answer that." Susan nodded slowly, crossing her arms. "You're right. You don't. But I need to be clear. Dr. Thompson is your assigned physician. If you refuse treatment, that's your choice, but we will document it. And if this is about anything other than medical competence, I strongly suggest you reconsider." Harris glared at her, but said nothing. Susan looked at Michael. "Dr. Thompson, you have my full confidence. The choice is his, but we are not in the business of catering to discrimination." Michael nodded, standing a little taller. Mrs. Harris, her voice barely above a whisper, said, "John, don't do this." Harris's eyes flicked to his wife, something unspoken passing between them. Finally, after a long pause, he muttered, "Fine." Susan nodded. "Good. Dr. Thompson will continue your care." She turned on her heel and left, Michael following. As he stepped into the hallway, he let out a breath he hadn't realized he was holding. Susan clapped a hand on his shoulder. "You handled that well." Michael exhaled. "It's not over. But at least he knows I'm not going anywhere." Susan smiled. "Exactly." And with that, Michael walked back toward his next patient, determined to prove that he belonged. The days following the confrontation with Dr. Susan Patel were tense. Dr. Michael Thompson continued treating John Harris as if nothing had happened, maintaining his professionalism. Harris, on the other hand, remained cold, answering only when necessary and avoiding eye contact. But something had shifted. He had stopped outright refusing Michael's care, though the resentment in his eyes had not disappeared. Michael wasn't naive. He knew that just because Harris had reluctantly accepted him as his doctor didn't mean his opinions had changed. But Michael also knew this wasn't just about Harris. It was about every other patient who might feel the same but never voiced it. It was about proving, not to himself, but to the system, that he belonged. One evening, Michael sat in the hospital's staff lounge, staring at his untouched cup of coffee. Dr. Patel walked in and immediately noticed his pensive look. "Rough day?" she asked, pouring herself a cup. Michael exhaled. "More like a rough case." She sat across from him. "Harris." Michael nodded. "I keep wondering, does it even matter? I'm doing my job, giving him the same care I would give any patient, but no matter what I do, I can tell he's just waiting for me to make a mistake." Susan leaned forward. "Michael, you're not responsible for changing his mind. You're responsible for treating him with the same skill and dedication you give to every patient. That's enough." Michael nodded, but didn't respond. He knew she was right. But knowing something and feeling it were two different things. A sudden emergency. The next day, Michael was reviewing patient charts when a nurse burst into the room. "It's Harris. He's in distress." Michael didn't hesitate. He rushed to room 307, where he found Harris clutching his chest, his face contorted in pain. His wife stood nearby, panic in her eyes. "John." "What's happening?" she cried. Michael immediately took control. "Mr. Harris, can you hear me?" Harris gasped. "Chest pain worse." Michael turned to the nurse. "We need a crash cart in here now. Get an EKG set up." The nurse moved quickly as Michael assessed Harris. His heart rate was erratic, his breathing shallow. This wasn't just discomfort, this was a potential heart attack. Michael grabbed his stethoscope and listened to Harris's heart. The irregularity in the rhythm confirmed his fears. "We need to get him to the ICU now." Harris barely registered what was happening, his face pale. As the team prepared to move him, his gaze locked onto Michael's for a fleeting moment. For the first time, there was no hostility, just fear. In the ICU, Michael worked with a team of specialists to stabilize Harris. The room buzzed with controlled urgency, machines beeping, nurses moving with precision, orders being given. Michael remained focused, blocking out everything except what needed to be done. "Harris is going into VFib," a nurse called out. Michael grabbed the defibrillator paddles. "Charging to 200 joules. Clear." A jolt ran through Harris's body. The monitor continued to show erratic spikes. Again, 300 joules. Clear. Another shock. A long beep, then a rhythm. Michael exhaled sharply as the monitor displayed a stable heart rate. "We've got him back." The team worked quickly, administering medications and ensuring Harris was stable. Michael wiped the sweat from his brow, his pulse still racing. That had been close. A shift in perspective. Several hours later, Harris regained consciousness. His wife was at his bedside, tears in her eyes. Michael stood nearby, checking the monitors. Harris blinked, disoriented. Then his gaze settled on Michael. For a moment, they simply stared at each other. "You saved me," Harris finally said, his voice hoarse. Michael nodded. "That's my job." Harris swallowed. There was something different in his expression. Hesitation, maybe even realization. But he didn't say anything more. Mrs. Harris, however, spoke up. "Dr. Thompson, thank you. Truly." Michael offered a small nod. "I'm glad he's okay. We'll continue monitoring him, but for now he needs rest." As Michael turned to leave, Harris's voice, weak but clear, stopped him. "Doctor." Michael looked back. There was a long pause before Harris said, "Thank you." Michael didn't smile. He simply nodded and walked out of the room, knowing that some barriers weren't broken in an instant, but sometimes survival had a way of changing people. The days following John Harris's near-fatal emergency were quiet. He was still in the ICU, closely monitored, but his condition had stabilized. Dr. Michael Thompson continued his rounds, checking on him each morning with the same professionalism as before. But something had shifted. For the first time, Harris didn't flinch when Michael approached. He didn't grunt dismissively or avoid eye contact. Instead, he listened. He still wasn't overly friendly, but the tension in the room had noticeably lessened. Mrs. Harris had been the first to acknowledge it. "I think he finally realizes you're on his side," she had told Michael one morning. "It took almost dying, but he sees it now." Michael had simply nodded. He wasn't looking for gratitude. He had done what any doctor would have done. But something about Harris's change in demeanor did feel significant. It wasn't until the day before Harris was set to be moved out of the ICU that Michael finally heard what he never thought he would. Harris was sitting up in bed, looking out the window when Michael entered. The morning light cast shadows across his face, making him look older, more worn than before. "How are you feeling today?" Michael asked, checking the monitors. Harris exhaled. "Better. The pain's manageable." Michael nodded. "Good. Your vitals are steady. If this continues, we'll move you to a standard recovery room tomorrow." Harris was quiet for a moment, then cleared his throat. "Listen. Document." He hesitated. "I owe you something." Michael raised an eyebrow, but didn't speak. He waited. Harris shifted uncomfortably. "I know how I acted when you first came in here. I know what you think of me. And you're not wrong." Michael remained silent, letting Harris find his words. "I grew up in a different time," Harris continued. "My father, he was a hard man. He taught me things I never questioned. Not until now." He swallowed. "When I saw you walk in that first day, I didn't trust you. Not because you weren't qualified. Just because of who you are." Michael met Harris's gaze. There was no hostility in it now. Just exhaustion. Maybe even regret. "But when I was dying on that table, none of that mattered," Harris admitted. "You were the one who brought me back. And that's something I can't ignore." Michael took a slow breath, choosing his words carefully. "I don't need an apology, Mr. Harris." "I know," Harris said, "but I needed to say it anyway." A long silence stretched between them before Michael finally nodded. "Rest up. I'll check on you later." As he turned to leave, he heard Harris murmur, "You're a damn good doctor, Thompson." Michael didn't look back, but for the first time since stepping into room 307, he felt something shift deep inside. A week later, John Harris was discharged. His wife gave Michael a heartfelt goodbye, squeezing his hand as she thanked him one last time. Harris himself simply gave a curt nod before leaving, but that was enough. Later that night, as Michael sat in the staff lounge, Susan Patel walked in and sat across from him. "So how does it feel?" she asked. Michael looked at her. "How does what feel?" She smirked. "Knowing you changed someone who swore he'd never change." Michael exhaled. "I don't know if he's changed, but he saw me differently, at least for a moment. And sometimes that's enough." Susan raised her coffee cup in a mock toast to breaking barriers, one stubborn patient at a time. Michael chuckled, shaking his head. He had fought to be seen, to be respected, to prove that his skills mattered more than the color of his skin. And while John Harris might not have completely changed, he had at least opened his eyes. And sometimes the first crack in a wall was all it took for it to come tumbling down.